The first thing I'll talk about is these injection therapies. So when we do injection therapy, the way I like to think about it is it's a very small needle. You get a vial like this. Every time you use the injection, what you want to do is clean the tip here, and then you take an alcohol wipe and clean, the penis model. And then what you do is pull the appropriate amount of medication into the syringe. I don't know if you can see here very well. I have some patients that inject a very small amount, as little as about a 0.05 cc's, and I have some guys that inject as much as half or 0.7 cc's. Once the medicine's pulled in, you make sure there's no air bubbles and have the medication here ready. You can cap it and leave it for later, or do your injection. The way the injection works is after the penis is clean, into either the 10 o'clock or 2 o'clock position, the needle goes into the penis. And then once it's in, you place the fluid in. Should take about 2 to 3 seconds to fill in, and then you take the needle out. Sometimes I'll take the alcohol swab and put pressure on the area of injection site because you may have a tiny bit of bleeding from where the shot went in. And then within 5 to 10 minutes, you should have an erection. The other thing I wanted to model is the penile implant. I hope everyone can see. This is that 3-piece penile implant, which is the most common implant we place. These are these 2 cylinders that sit inside the penis. They are connected to the pump and then connected to the reservoir. The reservoir either goes in the lower abdomen or down in the pelvic area. The only part the patient really interacts with is either the pump or the cylinders. What you do is you squeeze the pump. When you squeeze the pump, those cylinders then fill with fluid. And as you pump it up, you see you can achieve girth and length. The more you pump this device, the more you can fill. Your body will not allow you to overinflate the device. Then you can leave the devices inflated as much as you want. And then in order to release it, you press this button right here. By squeezing that button, it opens the valve back up, and then the fluid then shifts out of the penis and goes back into the reservoir for the next use. The penile implant device is completely concealed inside the body. So if you look at a model like this from Boston Scientific, you would say a patient that has an implant in place, you wouldn't know that it's there until you bring the pump up to the skin, and that's where this pump would sit.